Consider giving magnesium sulphate infusion to patients with prolonged QT and those with a high ectopic burden. In a patient brought with decreased GCS, consider a trial of naloxone if you suspect opioid overdose. Protect the airway, give oxygen, and check the blood sugar. If you're not sure your patient can have more IV fluids, check their IVC. Look for trifascicular and other blocks, as well as prolonged QT in all collapsed patients. Don't give fluids blindly to elderly patients with breathing difficulty before ruling out heart failure and valvular pathology. Do not prescribe fluids for a patient who is taking diuretics before knowing their fluid status. Cover patient with AKI and raised inflammatory markers with antibiotics. Keep record of all encounters in detail. Giving magnesium sulphate to a wheezing patient may translate into admission for monitoring. Magnesium sulphate must be given with the patient attached to a cardiac monitor. Patients can overdose on magnesium. Check their GFR before starting the infusion. Tachycardia can lead to pulmonary edema in patients with mitral stenosis and those who have diastolic heart failure, also known as heart failure with preserved ejection fraction. Check for allergies and obtain consent before injecting local anesthetics. Do not inject into a vessel. Obtain and document consent for any procedure. Have a chaperone in any encounter with female patients. Remember your wrist X-ray checklist when examining wrist radiographs. Patients with urinary tract pathologies can present with dramatic abdominal pain. The pain can be from a stone or urinary retention. Be mindful of killer headaches, including those from carbon monoxide poisoning, pre-eclampsia, and CSVT. Remember the indications for starting NIV. Get a chest X-ray beforehand. Tachypneic patients, hypoxic ones, acidotic ones, and those who are becoming tired of breathing are potential candidates. Don't overlook the scapula when examining chest X-rays. You might miss a fracture. Don't remote prescribe beta blockers for atrial fibrillation. The patient may have already reverted to normal rhythm. Do not give calcium channel or beta blockers to patients in acute heart failure. Just like GTN, must be avoided in patients with severe aortic stenosis.